Hi everybody, my name is Tyler Foster, and this video will cover the JNC8 hypertension guidelines. It's going to be in a format of 10 quiz questions. Now, why do I put it in quiz format? Well, I personally believe that a quiz is the best way to learn the new guidelines because it'll apply case scenarios and you'll have to think through why the answer choice is what it is. How it's going to work is I'll read the question prompt ahead of time. I'll give you about 10 seconds before I move on to the next slide, and I'll give you a 2 or 3 head second warning. If you need extra time to read the question answers and come up with your answer, I encourage you to pause the video, think about it, and then resume the video, and I'll move on to the next slide from there. So let's begin. Question 1. While working in an outpatient clinic, a 53-year-old healthy male with no comorbidities approaches you with concern over his blood pressure. He says his mom and dad both had high blood pressures and he may have it as well. You decide to educate him on the blood pressure guidelines. According to JNC8 hypertensive guidelines, which of the following is true? If you need more time, you can go ahead and pause the video now, but I'm going to move on to the next slide in 2 or 3 seconds. The answer is going to be C. For his given age, at 53 years old, his blood pressure should be kept below 140/90. So in individuals below 60 years of age, the guidelines state that the blood pressure should be controlled at 140/90 or below. Question 2. The same male patient comes back to your clinic 10 years later. He's now 63 years old, and he's also been diagnosed with chronic kidney disease. With regards to the JNC8 guidelines, what should you tell him about his blood pressure goals now? I'll be advancing to the next slide in 2 seconds. The answer is going to be C. His blood pressure goals are now different than normal age recommendations. He should be kept on his blood pressure regimen that keeps his blood pressure below 140/90. Now, how does this question differ from the last question? Because remember, before, his guidelines stated that his pressure should be 140/90, and here we see that his pressure should be below 140/90. That is unchanged. However, his blood pressure goals are different from normal age recommendations. Normal age recommendations state that in patients 60 and above, blood pressure should be kept at, let's see if I can bring up a pen here. They state that at 60 years and above, blood pressure should be kept at 150/90. However, he also has a comorbid condition, chronic kidney disease. So in patients with chronic kidney disease, the new goal is going to be with chronic kidney disease. The new goal is going to be 140/90. So we need to remember that his blood pressure goals are different because of his age. However, now we throw in also a comorbid condition, which is the chronic kidney disease. Because of this, we want to keep his blood pressure a little lower, so ultimately we want his blood pressure to be 140/90. Question 3. A 36-year-old female presents to the emergency room for an upper respiratory infection. On admission, her blood pressure is noted to be 180/100. Which of the following is true? I'll be moving on in 2 seconds. The answer is going to be D. She should come back on 2 separate occasions, 2 weeks apart, to recheck her blood pressure. Because the question prompt states that this is a one-time incidence of a high blood pressure. She could be in pain, which could artificially increase her blood pressure. She could have infection, or she could have other factors going on, such as stress, for example. What you'll do is you'll want to encourage her to come back and get a reading on 2 separate occasions that are spread at least 2 weeks apart to recheck her blood pressure. You cannot diagnose hypertension with an isolated high instance of high blood pressure. Question 4. Which of the following is not a proposed mechanism behind primary hypertension? Moving on in 2 seconds. It's going to be A. Hyperaldosteronism is not a proposed mechanism behind primary hypertension. Primary hypertension can also be called idiopathic hypertension, meaning that we don't quite know why hypertension exists. However, there are theories out there that obesity, environmental influence, and increased sympathetic output all contribute to hypertension. Hyperaldosteronism is also known to contribute to hypertension. However, this is not a cause of primary hypertension. It would be cause of secondary hypertension, or high blood pressure that results due to the secretion of an excessive amount of aldosterone. Question 5. A patient presents to the clinic with left lower abdominal mass. She states that it's gradually increased in size and that she has recently noticed an increase in heart palpitations, diaphoresis, and anxiety. Her blood pressure is measured at 212 over 108. She is diagnosed with a pheochromocytoma. How would you classify her blood pressure, and what long-term treatment should you initiate in this patient? Moving on in 2 seconds. The answer is D, secondary hypertension, and it is due to the course of action is to resect the pheochromocytoma. So this is a continuation of the last question. It's pretty much asking, is it primary hypertension or is it secondary hypertension? We know that pheochromocytoma is due to an excessive release of catecholamines. This is what causes the hypertension. It is not idiopathic or primary, but it is secondary to that release of catecholamines that the blood pressure is high. And what long-term treatment would you initiate? Short-term treatment would to produce alpha and beta blockers, but the long-term treatment is to reduce the pheochromocytoma, and as a result, the blood pressure should regulate down to normal pressures on its own. Question 6. Kidney disease is a proven cause of secondary hypertension. Which of the following is not a reason why patients with chronic kidney disease develop hypertension? Moving on in 2 seconds. The answer is A, an increased drug metabolism. The question states, which of the following is not a reason why patients with chronic kidney disease develop hypertension? It is because there is an electrolyte imbalance. When the kidney is not able to excrete ions in a normal fashion, you get abnormal lab values. And you also get retained fluid volume as a result of those ions. Because remember, water gets dragged by solutes, and the more solutes that you get reabsorbed or unable to filter out, the more fluid that's going to be resultantly reabsorbed. Also, the kidneys are an important source of hormones, and if you have chronic kidney disease, you're unable to regulate hormones the same. So the answer here by elimination is A, but just remember that kidneys do have some effect on drug excretion and partially drug metabolism, but it's not a major factor on why patients with chronic kidney disease develop hypertension. Question 7. A patient presents to the outpatient clinic for the third time with an increased blood pressure. They receive the diagnosis of hypertension and begin to discuss the treatment plan for managing their high blood pressure. According to current guidelines, JNC8 guidelines, how will you treat this patient? Going to move on in 2 seconds. The answer is C. Always, with a new diagnosis of hypertension, recommend lifestyle modifications and then reassess again in 3 to 6 months. So lifestyle modifications are going to include exercise and diet, such as a low-salt diet or the DASH diet. Question 8. A patient presents with hypertension and they refuse to take any drugs. He has read online that drugs can cause side effects and he'd prefer to try alternative treatments instead. You tell him that lifestyle modifications have been proven to reduce blood pressure. In addition to a low salt and balanced diet, what recommendations should you give to this individual? Moving on in 2 seconds. The answer is D. New guidelines state that aerobic exercise should be continued for 30 minutes at least 4 to 5 days per week. This has been proven to lower blood pressure. Question 9. There are many different treatment choices for hypertension. According to the newest JNC8 guidelines, what drugs are considered the first-line agents in a patient with no comorbid conditions? Moving on in 2 seconds. The answer here is C. Angiotensin converting enzyme inhibitors, or ACE inhibitors, or ARBs, calcium channel blockers, and diuretics are all considered first-line agents in dealing with patients with no comorbid conditions. Question 10. An 80-year-old patient with long-standing type 2 diabetes has a blood pressure of 138/98. Assuming this was the third elevated reading, which of the following is true? Moving on in 2 seconds. The answer here is going to be B. The patient is hypertensive since new recommendations for this patient are to maintain blood pressure at 140 and less than 90. So here we see the diastolic pressure of 98 is above the recommendation of 90. You also have the systolic volume. In a patient who is 80 years old, I've already stated that their guidelines in somebody aged 60 and above are going to be 150/90. Now, their systolic blood pressure is below 150, but their new guidelines state that in a patient with diabetes, you'll want to treat the blood pressure to below 140/90. So their guidelines are going to be 140/90. However, the patient is hypertensive since their diastolic pressure is 98, and the guidelines state that it should be kept below 90. Here's a little disclaimer. I did create all these questions. If you have any comments, questions, or concerns, be sure to ask. Otherwise, I do ask that you do not reproduce or use these questions in any other format except for studying for any quizzes, tests, or for knowledge's sake. Otherwise, be sure to comment, like, ask me any questions, or recommend any future videos. Thanks for watching.